So definition of blood. Blood is a liquid connective tissue in which intercellular substance called plasma and cells like RBC, WBC and platelets are suspended. The physical characteristics of blood. So blood is red in color, pH is slightly alkaline, that is 7.2, specific gravity is 1.055 to 1.060, blood volume in adult human body is roughly 5 liters and viscosity 5 times more than the water. So this is viscous because of the cells present in blood, that is WBC, RBC and platelets. So composition of blood, it is mainly of two things. The liquid portion is called as plasma and the solid portion is called as cells. So cells are of three types: RBC, platelets and WBC. So red blood corpuscles, platelets also called as RBC also called as erythrocytes, platelets are also called as thrombocytes, and white blood cells also called as leukocytes. Again, white blood cells are divided into two types according to the presence of granules in the cytoplasm. So if granules are absent, they are called as agranulocytes, and they are of two types, lymphocytes and monocytes. And if granules are present, they are called as granulocytes, and according to the color of the granules we can differentiate these cells. So pink color granules seen in neutrophils, orange color granules seen in eosinophils, and dark bluish color granules seen in basophils. Then plasma. So liquid portion is called as plasma, and it mainly contains water, 80 to 90% water, and then biochemical substances like organic and inorganic. So organic like glucose, fatty acid, amino acid, proteins. So these are all organic compounds, and inorganic like sodium, potassium, chloride, calcium, phosphorus, iodine, iron, magnesium. So these are all inorganic compounds. So these form the biochemicals which are present in plasma. Now we will see functions of blood. So main function of blood is nutritive in nature. So it is blood supplies glucose, amino acids, vitamins from the digestive system to all over the parts of the body through the blood. Then excretory function. So it excretes urea, uric acid and unwanted substances and water from the kidney. So it is excretory function. And the main function is respiratory function. So blood carries oxygen from lungs to tissues and carbon dioxide from tissues to lungs by hemoglobin. So hemoglobin combines with oxygen, forms oxyhemoglobin, and then it gives oxygenation to the tissues. And carboxyhemoglobin by combination of hemoglobin and carbon dioxide, and then it is going to lungs and then it is exhaled outside in the environment. Then defense function by WBCs, then acid base balance, regulation of body temperature, maintenance of viscosity, then water balance. Clotting of blood is because of the platelets, maintain colloid pressure and hormone transport. So the hormones produced by endocrine glands like thyroid gland produces T3, T4 and other hormones. So these are transported to all over the body through blood, and then the homeostasis, that is balance is maintained.
Hello students, today we will have blood collection procedure lecture. So blood collections are of three types: venous, capillary and arterial. So first we will see things required for blood collection. So what should be there in your blood collection kit? So there should be syringes of different sizes like 2 ml, 5 ml, 10 ml, needle of different sizes like 24, 22, 21 and 20 number, spirit, cotton swab, bulbs like EDTA for CVC, plain for all biochemistry and serology, fluoride for blood sugar level, citrate bulb for blood coagulation testings, tourniquet and sticking for the vein to become prominent, and then for the last sticking for the pressure. So first is site. So it is median cephalic vein of the forearm, or the whichever palpable, visible, prominent vein we can select of the arm, forearm, or from any wrist. Then select the vein and then clean it with spirit swab, and then apply tourniquet to make the vein prominent, and ask the patient to close the fist so that vein will become prominent, visible, and then with left hand steady the vein and then put needle into the skin and then puncture the vein and then collect the blood. Plunger is pulled back gently when blood starts flowing into the syringe. Then remove tourniquet, collect adequate amount of the blood and then ask the patient to open the fist and then remove needle, syringe, put pressure with spirit swab at the puncture site and then put your collected blood into the appropriate container. Then you have to put pressure for 10 to 15 minutes to avoid the complication like hematoma. Hematoma is the seepage of blood in the subcutaneous tissue. So uses of venous blood. So all hematological investigations. So preferably venous blood we require mainly for the very large quantity of blood is required. So like hematological investigations like ESR, PCV and other cell counts. Biochemical investigations where the serum is required. Serological investigations where the serum is required and for blood culture. So second method for blood collection is capillary method. It is also called as prick method or skin puncture method. So site in mainly adults it is ball of the left ring finger or lobe of the ear. In infants it is ball of the thumb, great toe or heel. Procedure, so first you have to clean the part with the spirit swab and then you have to take lancet or needle and then prick that area with help of lancet or needle and then first few drops you have to wipe out because it contains tissue fluid and then remaining blood is collected and then investigations done. So here you can see this third method, it is arterial blood collection method. So in that radial artery is preferred and then that is felt with 3 fingers at the radial side of the wrist joint below thumb and then where the radius bone is there, then clean that area and then puncture the needle, puncture the site with needle attached to syringe and then blood will come into the syringe and then adequate quantity of the blood is withdrawn and then apply pressure for 10 to 15 minutes with spirit swab. So today we will see lecture on anticoagulant. So definition, anticoagulants are chemical substances which required to prevent clotting of the blood when it is mixed with the blood in proper proportion. So in short we will see clotting mechanism. So when there is an injury to the vessel, so in first step the thromboplastin is released and then that is activated. Then in second step it activates prothrombin into thrombin and then it activates the fibrinogen into fibrin monomer and then all fibrin monomer combine to form fibrin polymer in which all the WBCs, platelets get entangled and then it forms the clot and then it covers that injury area and so that bleeding stops. Now we will see few examples of anticoagulants. So first is ideal anticoagulant used in hematology. It is EDTA, ethylene diamine tetraacetic acid. So mechanism mainly it is calcium chelating agent. So it removes calcium and so that there is no clotting and then blood is in liquid state. So uses of is all hematological investigations like HB, CBC, ESR, PCV and all cell counts. Second is trisodium citrate. It is 3.8 to 3.2%. Mechanism mainly it converts ionized calcium into unionized and because of that then they are not available for the blood clotting. Uses mainly by ESR by Vesegrin method and prothrombin time or blood coagulation tests like PT, PTT, APTT, etc. Third is sodium fluoride. So mechanism mainly it is prevent glycolysis of the sugar in the blood and because of that the blood sugar level is maintained because it prevents action of enzymes, glucose oxidize and uses is blood sugar level. Other anticoagulants. First is heparin. Action is antithrombin and use mainly it is for the blood gas analysis. Next is blood that is double oxalate. It is ammonium oxalate plus potassium oxalate and then uses are like EDTA. Now Potassium oxalate, it is mainly used for the blood urea level. Plain bulb, where the no anticoagulant is added, and it is mainly required for the serum preparation, which is required for the biochemical and serological investigations. Anticoagulants used in blood bank. So first it was ACD, that is acid citrate dextrose. Then it was CPD, that is citrate phosphate dextrose, and now it is used is CPDA, that is citrate phosphate dextrose adenine, or sometimes SAGM, that is saline adenine glucose mannitol. So we'll see functions of each component. So citrate, it acts as a anticoagulant. Phosphate, it acts as a buffer. Dextrose, it gives nourishment to the RBCs to be kept for more days. And mannitol, it is a membrane RBC membrane stabilizing agent. So ACD, blood can be stored up to 21 days. CPD, blood can be stored up to 30 days. CPDA, blood can be stored up to 35 days. And SAGM, blood can be stored up to 42 days. And this SAGM mainly used in a high setup blood banks. Hello students, today we will talk liquid portion separated from blood after clotting. So in that anticoagulant is not added, and because of that clotting mechanism takes place. Plasma is liquid portion separated without anticoagulant, and therefore clotting mechanism doesn't take place. So clotting factors are not present in serum, but clotting factors are present in plasma. Serum is used for preparation mainly for the investigations of biochemistry or serology, and then in that plain bulb you have to use for collection of the blood. Plasma is used mainly for the blood coagulation test like PT-PTT, APTT, or blood sugar test like fluoride bulb is used, and for blood coagulation test citrate bulb is used.
So definition, it is conjugated protein, that is it is mixed protein synthesized in RBC, and it is of two components, heme and globin, and because of that it gives red color to the RBC or blood. Structure, it composed of heme and globin. Heme is composed of iron plus protoporphyrin, and globin is composed of 4 polypeptide chains, 2 alpha and 2 beta. Function of hemoglobin is to carry oxygen from lungs to tissues, to carry carbon dioxide from tissues to lungs, and acid base balance or buffer. Types of hemoglobin, they are different, like oxyhemoglobin, carboxyhemoglobin, sulfhemoglobin, methemoglobin, or abnormal hemoglobins like HbS, which is seen in sickle cell anemia, HbF, which is seen in thalassemia, that is fetal hemoglobin. Normal range of hemoglobin in males it is 14 to 18 gram percent, and in females it is 11.5 to 14.5 gram percent. In liver, here you can see this cycle. So in liver, this protoporphyrin forms which is of 4 protoporphyral rings. It is combined with glucuronic acid and forms conjugated bilirubin. Then from this it will go to the small intestine, that is duodenum, from the bile duct, and then it will go to the large intestine, and where the because of the bacterial action it is converted into the stercobilinogen, and then it is excreted into the stool. Some part of the conjugated bilirubin will go to the kidney through circulation, and then it is converted into urobilinogen, and it is excreted in the urine. So this all the hemoglobin metabolism, that is breaking down of the hemoglobin, and then excreted unwanted part of the hemoglobin, that is by pigments, that is stercobilinogen and urobilinogen. Thank you. So now normal range in male it is 4.5 to 6 million cells per cubic millimeter. In female it is 4 to 4.5 million cells per cubic millimeter. Clinical significance, when the RBC count is increased, it is called as erythrocytosis, and it happens in hemoconcentration. And when the RBC count is low, it is called as erythrocytopenia, and it happens usually in anemia, pregnancy and old age. So normal value is 2.5 lakh to 5 lakh cells per cubic millimeter, and significance, when the count is increased it is called as thrombocytosis, and when the count is decreased it is called as thrombocytopenia, and it is usually seen in aplastic anemia, megaloblastic anemia, acute leukemia, falciparum malaria, dengue, viral infection, etc. Thank you. Normal value in adult, the WBC count is 4,000 to 10,000 cells per cubic millimeter, and at birth it may vary from 10,000 to 25,000 cells per cubic millimeter. Increase in WBC count is called as leukocytosis, and it can be seen in infections like bacterial, viral, protozoal. Leukopenia is fall in WBC count and below 4,000 cells, and it is also called as leukopenia, and it is seen in typhoid, tuberculosis and influenza, and also in HIV. Thank you. So pathological leukocytosis, that is WBC count is increase. So it is because of the neutrophils. So neutrophilia is increase in neutrophil count, and it is seen in bacterial infection like staphylococcus, streptococcus, pneumococcus, or non-inflammatory rheumatoid arthritis, acute rheumatic fever, operation, fracture. Lymphocytosis, it is increase in lymphocyte count, and it is usually seen in viral infection and bacterial infection like typhoid, tuberculosis, syphilis. Leukopenia, when the leukocyte count is less than 4,000 cells per cubic millimeter. So it can be because of the neutropenia or lymphopenia. So neutropenia examples are when the neutrophil count is less than 40%. So it can be seen in typhoid, viral infections like measles, influenza, in anemia like aplastic anemia, megaloblastic anemia, iron deficiency anemia, or bone marrow depression by chemotherapy, radiotherapy. Then lymphopenia can be it is less than 20% lymphocytes in the peripheral blood smear. So it can be because of the acute infection or viral infection, typhoid, or excess irradiation, or some cases of leukemia, AIDS, anemia, pancytopenia. So these are the conditions where you can see lymphopenia. Thank you. So definition: when anticoagulated blood is allowed to stand undisturbed for a period of time, that is 1 hour, then RBCs sink to the bottom, and then two layers are formed. Upper layer, that is liquid portion, is called as plasma, and the lower layer is of red blood cells, that is red in color. So the rate at which the cells fall down is called as ESR, or erythrocyte sedimentation rate. So sedimentation means sedimenting down or falling down. So ESR is of prognostic value, not a diagnostic value. So stages are 3 stages. First, aggregation, so cell come together, then formation of rouleaux, that is they pile on each other in form of coin, and then sedimentation, that is falling of the RBCs. So procedure is by 2 methods: Westergren method or Wintrob method. So long tube is called as which has marking 0 to 200, it is called as Westergren tube, and Wintrob tube is of 0 to 10 marking. So fill the Westergren or Wintrob tube and then wait, keep it in stand and then wait for 1 hour and then take the reading. So that is the procedure. So we'll see procedure of PCV by Wintrob method. So fill the Wintrob tube with blood with help of pasteur pipette, then keep it in centrifuge. Take another Wintrob tube filled with water and put it in the centrifuge opposite to the balance, to the previous tube for the balance, and then centrifuge it for 30 minutes and then take the reading of red cell column from the bottom of the tube. So they are MCV, MCH and MCHC. So MCV is mean corpuscular volume. So it is roughly 82 to 92 femtometer, and if it increase, it is seen in usually macrocytosis, that is megaloblastic anemia. If MCV is low, it is seen in microcytosis, that is iron deficiency anemia or thalassemia. MCH, mean corpuscular hemoglobin, it is 27 to 32 picogram, and it is decreased in hypochromia, and it is seen in iron deficiency anemia or thalassemia. MCHC, it is mean corpuscular hemoglobin concentration, it is 32 to 36%, and if it is decreased, it is seen in hypochromia, that is iron deficiency anemia or thalassemia. So these MCV, MCH, MCHC are called as blood cell indices or erythrocyte indices or Wintrob's constant, and they are used for the morphological classification of anemia. Thank you. Hello students, today we will see topic anemia. So what is its definition? When the hemoglobin value is low than the normal range, it is called as anemia. So in males it is less than 14.5 and in females it is less than 11.5 gram percent, it is called as anemia. So classification, it is of two types: etiological classification and morphological classification. So etiological classification is based on the etiology. So what is the reason? So first is blood loss, maybe in accident, injury or operation leads to anemia. Second is impaired red cell production. So RBCs are not produced because of the deficiency of iron, vitamin B12, folic acid, proteins, etc. Or they are normal, but they are the excessive destruction is there, that is seen in hemolytic anemia. So second classification is morphological classification. It is depending on the MCV, MCH and MCSC, that is RBC indices. So first is normocytic normochromic anemia. In that MCV, MCH, MCSC, that is mean corpuscular volume, mean corpuscular hemoglobin and mean corpuscular hemoglobin concentration are normal. So in that RBC size is normal and hemoglobin is normal. Second is microcytic hypochromic anemia. In this MCV, MCH and MCSC are decreased. So in this RBC size is decreased and hemoglobin value is low. So examples of this is iron deficiency anemia and thalassemia. Third is macrocytic anemia. In this MCV is more than 96 femtometer and it is seen in megaloblastic anemia, pernicious anemia. Thank you. So now we will see in short clinical features. So there is fatigue, tiredness, loss of weight, loss of appetite, breathlessness, palpitation. Investigations in routine, we have to find out the whether anemia is there or not there. So by that we can do by doing HB, CBC, ESR, PCV, peripheral blood smear for RBC morphology, red blood cell indices, urine stool routine, etc. In specialized investigation, we have to find out which type of anemia is there because the treatment is different. So first very common is iron deficiency anemia. So in that iron profile is done, that is serum iron and serum ferritin and percentage saturation is done. In thalassemia, hemoglobin electrophoresis, hemoglobin F, osmotic fragility test is done. Sickle cell anemia, sickling test, osmotic fragility test and confirmatory test, that is hemoglobin electrophoresis is done. Megaloblastic anemia, you can do serum vitamin B12 folic acid for confirmation. Pernicious anemia, along with vitamin B12 and folic acid, intrinsic factor serum studies is done. Hemolytic anemia, mainly it is retic count, and in PBS you can see normoblast and then osmotic fragility test. Aplastic anemia, when the picture is of pancytopenia, that means all the cells are decreased. So in that you have to do bone marrow aspiration, either aspiration or biopsy. So that is bone marrow examination. Thank you. Normal value by Duke's method is 1 to 5 minutes, and significance of this is it is increased in usually bleeding disorders like platelet disorder, that is thrombocytopenia, and which happens in falciparum malaria, dengue fever. Thank you. So normally by capillary method clotting time is 4 to 9 minutes and it is usually increased in clotting disorders like hemophilia, which is factor 8 or 9 deficiency. So hemophilia is factor 8 deficiency and hemophilia B is factor 9 deficiency. Or other clotting factor deficiencies also you can see raised clotting time. Thank you. So what is blood group? So they are red cell antigens. So the antigens present on red cell give the blood group characteristics. So this opposite of to that is the antibodies present in serum. So they are called as natural antibodies, and immune antibodies, if they are produced because of the antigen is not present in blood, and if it is introduced into the blood, then it produces antibodies. They are called as immune antibodies. So in this chart you can see group, antigens present on RBC and antibodies. So in A group, A antigen is present on RBC and anti-B antibody is present in serum. In B group, B antigen present on RBC and anti-A antibody present in serum. So it is opposite of the antigen, that antibody is present in the serum. So these anti-A and anti-B, they are called as natural antibodies. In AB group, A and B, both antigens present on RBC, so no antibody present in serum. In O group, antigen is not present, either A or B, so anti-A and anti-B, both antibodies are present in serum. Now methods of ABO blood grouping. So they are mainly two methods, forward and reverse. So forward is also called as cell grouping and reverse is also called as serum grouping. So in forward or serum grouping, we have to take cells suspension RBC of the patient, and then we have to add known antiserals. And in serum grouping, you have to take serum of the patient and you have to add known cells of the from the kit. So and then we will see the clumps. And for RH blood grouping, only forward grouping is there, that is cell grouping. Reverse grouping is not there because natural anti-D antibodies are not there. Some points about Bombay blood group. So it is discovered by Bhinde. So normally H antigen is present. It is seen in saliva, seminal fluid. So it is also called as secretory antigen. So if H antigen is absent, then you will see anti-H antibodies in the blood. So normally it is H antigen present in blood, so no anti-H antibodies are seen. But in O group, if O positive, then the anti-A and anti-B, both antibodies are seen in O group and no antigen. So OH, that is Bombay blood group, anti-A, anti-B and anti-H antibodies are seen because H antigen is not there. So when O group is given to the O patient, but if the patient is Bombay blood group, then this anti-H antibody will react with the H antigen present in the patient and there will be lysis of the blood. So the Bombay blood group patient should get Bombay blood group donor. Now little bit about RH antigen. So RH antigen, it is discovered in rhesus monkey, and when 1 drop of blood is taken, 1 drop of anti-D from the kit and see for the clumps. So if you see clumps, it is RH positive. If you see no clumps, it is RH negative. And natural RH antibodies are not present. They are immune antibodies. When the RH negative person gets exposed to RH positive blood, then there is formation of antibodies, and then that is called as RH antibodies. So it can be seen in mismatched blood transfusion or hemolytic disease of newborn. Now we will see significance of blood group. So significance of blood group, the blood group, everyone should know their blood group, because when in accident or in surgery, when too much blood loss is there, then we need blood. So which blood to be taken from donor, we should know that to prevent the hemolysis of the blood or mismatched blood transfusion. Again, in pregnancy also, mother and father blood group should be there, because if mother is negative, if father is positive, then if baby is positive, then that D antigen will cross to the mother through the placenta, and in next pregnancy, because of the anti-D, the immune antibodies are formed, and in next pregnancy, D antigen of the fetus will react with the anti-D antibodies and it will cause hemolytic disease of newborn. Again, for identity purpose also, for medical legal purpose also, this blood group should be known.
Hope you find this session useful for your understanding and for your exams. Thank you.